Today, we are going to take a look at a BodyViz brain builder about the menstrual cycle and then walk through a case study example. Think the menstrual cycle is just about periods? Think again. In this brain builder, we'll uncover how hormones drive the menstrual cycle and what an abnormal cycle may look like. The menstrual cycle is a hormonally regulated process that typically begins around the age of 12, following the development of secondary sex characteristics like breast and pubic hair growth. While the average cycle lasts about 28 days, a normal range is 21 to 40 days. Irregularity is common in adolescence but often stabilizes with age. Before diving into the hormonal phases of the menstrual cycle, it's helpful to first understand a few key anatomical functions. A female has 2 ovaries that store and release eggs. Each month, one ovary typically releases an egg into the fallopian tube, where it may be fertilized. The egg then travels toward the uterus, which has an inner lining called the endometrium. This lining thickens in preparation for a fertilized egg to implant. If fertilization does not occur, the lining is shed. A healthy menstrual cycle defines this pattern. The cycle is regulated by a complex hormonal system known as the hypothalamic pituitary ovarian axis, or HPO for short. The hypothalamus releases gonadotropin-releasing hormone, GnRH, stimulating the pituitary gland to secrete follicle-stimulating hormone, FSH, and luteinizing hormone, LH. These hormones act on the ovaries to stimulate follicle development and prompt the production of estrogen and progesterone. While progesterone is a single hormone, estrogen refers to a group of hormones, including estradiol, estrone, and estriol, which each have unique roles. Together, estrogen and progesterone not only prepare the body for a potential pregnancy, but also support other vital functions like bone density, cardiovascular health, and mood regulation. The ovaries also produce small amounts of androgens, which are hormones commonly associated with male traits. Androgens are important for libido, energy, and overall hormonal balance. The menstrual cycle is divided into 4 distinct phases. Phase 1, the menstrual phase, or menses. This first phase marks the beginning of a cycle. During the menstrual phase, the endometrial lining is shed due to a drop in estrogen and progesterone levels, as long as fertilization has not occurred. Fertilization, of course, leads to pregnancy. On average, this part of the process lasts 1 to 5 days. The follicular phase, the second phase, will overlap with the menstrual phase, occurring during days 1 to 13 of a typical cycle, but it will continue until ovulation. The follicular phase is characterized by the growth and maturation of ovarian follicles under the influence of FSH. Also, estrogen levels will increase here and cause the endometrial lining of the uterus to start regenerating. Around day 14, the third phase, also termed the ovulatory phase, is triggered by a surge in LH. The dominant follicle releases an egg into the fallopian tube, where it may be fertilized. In the fourth phase, the luteal phase, which lasts from ovulation to the start of the next cycle, days 15 through 28, the ruptured follicle transforms into the corpus luteum, which secretes progesterone and a bit of estrogen. Together, these hormones maintain the endometrium to prepare for a possible implantation. Implantation refers to the embedding of a fertilized egg into the uterine wall, which marks the beginning of pregnancy. If pregnancy does not occur, hormone levels drop, the corpus luteum degenerates, and the cycle continues with the next menstruation. Many factors can influence the menstrual cycle. Variations may be physiological, lifestyle-related, or pathological. Amenorrhea, the absence of menstruation, caused by intense physical activity, disordered eating, certain medical conditions, pregnancy, or menopause. Irregular cycles, often linked to stress, hormone imbalances, nutritional issues, or medication. Menorrhagia, or heavy bleeding, may result from hormonal imbalance or uterine fibroids. Endometriosis. Endometrial tissue grows outside the uterus, causing pain and fertility issues. Polycystic ovarian syndrome, or PCOS. causes irregular periods, elevated androgens, which are a group of hormones, including testosterone, that play key roles in male traits, acne, and infertility, fibroids, benign tumors that can cause heavy or painful periods, menopause, the natural end of menstruation, typically between the ages of 45 to 55, marked by a significant drop in estrogen and progesterone. To evaluate irregularities, healthcare providers conduct comprehensive assessments such as physical examinations, where patient history such as menstrual patterns, diet, exercise, sexual activity, and medications are reviewed. Pelvic examinations are performed to check for anatomical abnormalities or signs of infection. Laboratory tests will assess levels of thyroid hormones, which can cause menstrual irregularities if at higher or lower levels than normal, HCG levels, which can confirm or rule out pregnancy, FSH and LH levels to assess ovarian function or possible pituitary disorders, prolactin levels, which, when elevated, can indicate pituitary abnormalities or pregnancy, estrogen and progesterone levels, which, when imbalanced, can indicate menopause or reproductive dysfunction, and imaging. Ultrasounds, CTs, and MRIs are used to detect fibroids, cysts, tumors, or structural abnormalities in the uterus and ovaries. Since the causes and conditions can vary, the treatments do as well. Medications. Birth control pills can regulate bleeding and reduce symptoms. However, they can have side effects such as nausea, breast tenderness, bleeding, blood clots, and blood pressure changes. Antibiotics may reduce their effectiveness as well. Progesterone therapy can help manage heavy bleeding. Metformin can regulate cycles in individuals who have PCOS by lowering insulin resistance. Non-medicinal approaches. Warm or cold compresses can alleviate menstrual pain. Nutritional and psychiatric counseling may be a treatment approach for those with disordered eating or emotional factors, such as stress or depression, that are impacting menstruation. Procedures and surgery. Endometrial ablation is a procedure that destroys part of the uterine lining to reduce heavy bleeding. Hysterectomy is the surgical removal of the uterus and ovaries to end the menstrual cycle. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 20. Sex, female. Chief complaints, no period for the past 6 months. Fatigued, increasingly anxious, and unusually cold in warm environments. She denies sexual activity and is not on birth control. You invite the patient into your office for an examination. Your patient is a college athlete who maintains a strict low-fat diet and trains intensely with little rest. Her BMI is 17.5, suggesting she is underweight. Her main concern is her lack of a period for the past 6 months. You start by having her take a pregnancy test, which is negative. Blood work shows low FSH, LH, and estradiol, indicating suppressed HPO axis activity. Prolactin is normal, ruling out a pituitary tumor. A bone density scan, using a DEXA machine, reveals lower than normal bone density, likely due to low estrogen levels. With this information, you diagnose hypothalamic amenorrhea, a condition caused by energy deficiency from excessive exercise, insufficient nutrition, and psychological stress. To treat your patient, you refer her to a dietitian to help her increase her caloric intake and a therapist for support with food, body image, and stress. You also recommend scaling back her training to allow for more rest. To protect her bone health, a low-dose estrogen supplement is prescribed. Over the next several months, your patient gains a healthy amount of weight and adopts a more balanced training schedule. Her energy and mood improve, and her period returns. Follow-up labs show rising estrogen levels and stable bone density. With proper treatment, her cycle and overall health begin to recover. This has been a classic example of hypothalamic amenorrhea. Thank you for watching this Brain Builder video. Please like and subscribe to our YouTube channel, and if you are new to BodyViz, check out our other anatomy resources and schedule a demo today at bodyviz.com.